My name is Steve Bialick. I'm a medical oncologist, a gastrointestinal medical oncologist down in South Florida at the University of Miami. And it's a great privilege to speak to you guys today about pancreatic cancer. I titled the presentation Pancreatic Cancer 101 just to give kind of the nuts and bolts of a diagnosis of this disease. And we'll kind of go through the way that I discuss with my patients when they're diagnosed with this type of cancer, how they were diagnosed, what the symptoms were, and what the next steps are in treatment. So I have no disclosures and we can get right into it. And I thought that the first slide we should talk about, just like with any discussion of any type of cancer diagnosis, is really the anatomy of where your cancer started. As a gastrointestinal medical oncologist, I treat cancers of the esophagus, of the stomach, of the colon, the small intestine, and what we call the hepatobiliary tract, the liver, the gallbladder, the pancreas. And when we talk about the pancreas specifically, it's really important to understand the anatomy of where this organ lives, what lives around it, what's in its neighborhood, and what the cells that make up this organ are doing. So, kind of on this slide, what you can see is a cutout of a human body, and even though this person is facing us, you'll see that on the left side of the computer, it's really the right side of the person. This, where my mouse is pointing, is the liver. And right underneath the liver is an organ called the gallbladder. And a little bit to the left of that, the right on the screen, but the left of the person, is the stomach. That's this big organ here. Directly in front of the stomach is the pancreas. And why I'm highlighting this so importantly is because what we need to know about the pancreas is that there's two different types of cells that truly comprise this organ, and they do different things. There are endocrine cells, which are the cells that secrete or release hormones into the bloodstream. And then there are exocrine cells. The names are a little bit scientific and sometimes hard to pronounce, but what these exocrine cells do is they secrete or release these pancreatic enzymes into what we call the pancreatic duct. The pancreatic duct leads into the small intestine. The part that's on this screen here is called the duodenum. But the reason for all this jargon is to explain that these exocrine cells are what's important for making digestive enzymes. So when we eat food, cheeseburger, chicken sandwich, the food gets digested through the enzymes that are made in the pancreas, and they're released into the small intestine, and we process all these nutrients so that we can thrive and grow as human beings. When there is a tumor in the pancreas, or these exocrine cancers, the digestive process is a little bit disrupted. And so we'll talk about this in a few slides, but one of the presenting signs or symptoms of pancreatic cancer in general is weight loss. There are several reasons for that weight loss, but one of them is the low enzyme production. So these exocrine cells that are making these enzymes so that we can digest our food are either made in less by number, or there's something wrong with the process of digestion in general because of the tumor. But I also wanted to highlight on this slide, the pancreas lives directly in front of the stomach. So naturally, when we eat, our stomach expands. And then these stretch fibers tell our brain, we've eaten too much, let's pause or pump the brakes. When someone eats food and they have a pancreatic tumor, the stomach kind of rubs up against that tumor, signaling that same uh, fiber to the brain to say, eat less. Even though they may not have eaten a lot, it's a small amount of food that can make people feel less hungry faster. And the third reason why people lose weight with pancreatic cancer is just the sheer nature of cancer cells growing and dividing. So with that background of where the pancreas is and what it's doing, I wanted to take that with us as we talk about the different kinds of pancreatic cancer in general. The focus of our conversation today is one specific type of pancreatic cancer. The most common type is called ductal adenocarcinoma. You may see it written as PDAC, PDAC for short. And that makes up about 85 or 90% of these pancreatic cancers. There's several other kinds, but these are the cancers made of those exocrine cells I mentioned on the slide just before. Those endocrine cells give rise to a different type of pancreatic cancer, a less common one that makes up about 5 to 10% of pancreatic cancers, in a whole other conversation that we could have called neuroendocrine tumors, or PNET. But the focus of our talk today is going to be pancreatic ductal adenocarcinoma, which is the general run-of-the-mill term when you hear somebody typically say they have a diagnosis of pancreatic cancer.